Hi there, I'm Picon. So you wanted to learn a little bit more about type 1 hemochromatosis. Maybe you or a loved one are experiencing symptoms or recently got diagnosed. Maybe you just want to be more informed. Regardless of the reason, this presentation will provide you a complete comprehensive overview, including symptoms, causes, and most importantly, options. Type 1 hemochromatosis is a genetic disorder that is categorized by the dysregulation of iron in the body. This dysregulation causes iron levels to accumulate, leading to a toxic overload. So what are the symptoms of type 1 hemochromatosis? Different symptoms accompany each stage of this disorder. The onset of symptoms are a manifestation of iron levels accumulating in the body. In the beginning, one may expect to experience fatigue, pain in the joints, weight loss, libido loss, discoloration of skin, and a general weakness throughout the body. If symptoms progress, one may experience abdominal pain, alopecia, heart arrhythmia, or hyperpigmentation. In the later stages, the level of iron in the body will become toxic. This will damage the heart, liver, and kidneys. It's important to note that most people with type 1 hemochromatosis will not develop more serious symptoms past the early stages. However, late-stage damage to the heart, liver, and kidneys cannot be reversed. That is why early detection is so important. What causes type 1 hemochromatosis? As previously mentioned, this is a genetic disorder, meaning that it stems from a genetic mutation. I want you to think of genes as the written instructions for our body. And it is the HFE gene that writes the instructions on how our body should regulate iron. In a healthy body, the HFE gene produces a protein that is able to work and communicate with others on the release and absorption of iron in our body. However, there are two primary mutations that can inhibit the way the HFE gene is able to make this regulating protein. You see, genes are made up of amino acids, and these amino acids need to be in a specific order in order for the gene to function correctly. In these two mutations that primarily cause type 1 hemochromatosis, there is a substitution for one amino acid for a different amino acid. In mutation C282Y, there's the substitution of tyrosine for cysteine at position 282. In our second mutation, H63D, there is the substitution of histidine for aspartic acid at position 63. So how common is this mutation? You may be surprised to find out that this is the most common single gene disorder in the Western Hemisphere. This disorder affects 1 out of 200 to 300 people in the Western Hemisphere and disproportionately affects Caucasians. Because most people don't develop severe symptoms, majority of those with the disorder do not know that they have it. However, men are more likely to experience extreme symptoms. 1 out of 10 men with this disorder will develop liver disease. So we've established that type 1 hemochromatosis is caused by genetic mutation. But how would one get that genetic mutation? Well, this disorder follows an autosomal recessive pattern of inheritance. That means an offspring would have to receive 2 copies of this gene, one from each parent, in order to inherit the disorder. A person who only has 1 copy of a mutated gene will not display the disorder themselves, but is considered a carrier. This is because they're able to pass down the gene to an offspring. If 2 carriers have a child, that child has a 25% chance of having type 1 hemochromatosis. That child has a 50% chance of being a carrier like their parents, and has a 25% chance of not inheriting any mutated genes and being unaffected from the disorder. This pedigree allows us to visualize the predictive patterns of the disorder. If you, or somebody that you know, believes that they are affected by type 1 hemochromatosis, the most assured way to receive confirmation is through a genetic test. For this genetic test, there are 2 methods of collecting DNA, a blood test or a cheek swab. Either test will scan for the 2 primary mutations. If your test is normal, you will be found negative for each mutation. If your result is abnormal, you will be found positive for each mutation. An abnormal test result does not necessarily mean that you have type 1 hemochromatosis. It only means that you were found positive for the mutation. A healthcare provider or genetic counselor will help you interpret the results. This genetic test comes with little to no risk associated with genetic testing, and early detection is extremely important. Due to the way that typical symptoms progress, most people don't find out that they have this disorder until much later in life. For men, it's between ages of 40 to 60. For women, it's not until after menopause, up to 10 years. If you are an at-risk individual between 18 and 30 years of age, it is recommended that you regularly receive genetic blood tests to test for type 1 hemochromatosis. Remember, the later stages of this disorder is categorized by heart, liver, and kidney damage. This is damage that cannot be reversed. Early detection is extremely crucial to prevention. So where can you get a genetic test? I recommend asking your primary healthcare provider if they are able to order genetic tests that can be used at your next appointment. I also recommend visiting a genetic counselor. This is a specific kind of healthcare professional centered around genetic testing and options afterwards. It's also possible to order genetic tests straight to your door. Direct-to-consumer genetic testing offers at-home genetic testing kits. These testing kits typically include all necessary materials and instructions on how to collect your sample, package it, and return it to the company. Your results will be mailed back to you at a later date. I recommend that these results get interpreted by a medical professional to ensure the clearest comprehension. I hope that I was able to provide you with insight on type 1 hemochromatosis. I provided my references for your own personal research needs. Thank you.